Substance Use Disorder by Chioma Odili, RN, BSN. Substance use disorder is a condition that consists of substance abuse and dependence. This causes a decrease in functionality in work, school, and family obligations. Such substances include alcohol, stimulants, sedative hypnotics, opiates, cannabis, and other prescribed or street drugs. In 2011, the Substance Abuse and Mental Health Service Administration reported that 22.1 million people were classified with substance dependence or abuse within the past year. Secondly, 23.1 million persons aged 12 or older needed treatment for an illicit drug or alcohol use problem in 2010. The total cost for an average length of stay in an inpatient psychiatric hospital is $5,500 per person. So what really is the problem? Are environmental influences the only cause of the high prevalence of substance abuse? Well, several recent studies suggest that genetic factors grossly influence the individual risk in developing substance-related problems. In fact, Wong, Mill, and Fernandez reports that heritability of substance use disorder ranges from 30 to 70%. The purpose of this project is to identify current research findings on the genetics of substance use disorder, to identify implications of genetics as a risk factor for specific substance vulnerabilities, to report evidence-based knowledge of genetic vulnerabilities to the specific substances by developing a table identifying and depicting genes involved with each substance of dependence. Lastly, to present the findings to the psychiatric mental health care providers at Harris County Psychiatric Center in Houston, Texas. The project objectives include conducting a literature search on the relationship between genetic markers and substances of abuse within 4 months, to develop a table identifying the genes involved with each substance dependence, to present the findings in the form of an educational event to the psychiatric mental health care providers. Lastly, to administer a pre- and post-presentation survey to the psychiatric mental health care providers to complete. So what are the incentives? It will increase the knowledge base of the psychiatric mental health care providers. It identifies the specific gene markers for substance of abuse. And lastly, it aids in providing individualized care. An internal environmental scan reveals strengths and weaknesses, and the external environmental scan exposes the threats and opportunities. A strength is that the foundation of this project is evidence-based. This project involves already published research literature that identifies current findings on the genetic vulnerabilities to the substance abuse. And lastly, this project findings may be used as a stepping stone for updating clinical practice guidelines. A weakness of the project is that there's a lack of time and it's time consuming. It requires a lot of time to perform. And lastly, it may not be adopted by the psychiatric mental health care providers. Within the external environmental scan, the opportunities is that 22.1 million persons aged 12 or older were classified with substance dependence or abuse, and there's a moderate to high heritability rate of substance use disorder. A threat is that this project generates no revenue and has a high budget. Also, this project may not be approved by the administrators at Harris County Psychiatric Center. So who are the stakeholders? The stakeholders of this project include psychiatric mental health care providers, patients, administrative staff at Harris County Psychiatric Center, and the people who live in the community. The administrative staff and psychiatric mental health care providers are the early adopters. Let's take a look at the budget. The total funds requested for this project is $18,287.29. The total direct cost is $13,031.31, which is comprised of the personnel cost of $10,624. The fringe benefit at 8% which is $849.92. Traveling costs $99. Equipment costs $540. Supplies cost $118.46, and an in-kind contribution costs $800. Again, the total requested funds is $18,287.29. This project requires a claim for exemption by the Human Subject Review Committee because there's no human subjects involved. This project consists of a literature review. In conclusion, substance abuse is a problem that affects millions of people in the society and directly affects healthcare costs. Adoption of this project will potentially reduce healthcare costs by decreasing the admission rate into inpatient psychiatric facilities. Also provides research findings on relationships between the genetic markers and specific substance of abuse. And lastly, it supports psychiatric mental health care providers in providing individualized health care. Thank you.